I'm Casey, and this is my fiance Jonathan, and we spent our afternoon today in the infusion room at my rheumatologist's office so that I could get treatment for psoriatic arthritis. So I have psoriatic arthritis, and we should tell them what that is, but like really briefly.
Sure.
You tell them what it is.
Psoriatic arthritis is an autoimmune condition in which, like, you have psoriasis along your skin and damage to your joints, muscle tissue, tendons.
Not the muscles.
Oh, okay. Tendons, damage to your joints, tendons, and
Ligaments.
Ligaments, and
Sometimes you get like bonus prize of eye inflammation, and I also have hearing involvement, which is a thing. And a lot of people with psoriatic arthritis also have co-occurring GI problems, which I have, because people with autoimmune conditions are often lucky enough to have multiple. It's a really fun time. So what's an autoimmune disease, John?
autoimmune disease is when your immune system of your body seems to see.
It's on autopilot.
Yeah, well, it seems to see yourself as a threat, and your immune system attacks your own tissue and leads to inflammation, discomfort, tiredness, a number of other horrible
Fatigue.
lethargy,
Lethargy. Malaise.
Yes, leads to a bunch of horrible number of side effects. I mean, I myself have SLE, which is another version of an autoimmune issue.
That's lupus.
Yes, it's not a good time.
I've had symptoms of psoriatic arthritis for like over a decade, and I saw lots of different doctors who clearly never spoke to each other and connected the dots. So I was always sort of grasping at straws for what was going on, and a lot of times I got partial treatment that didn't treat the underlying issue, or was told it was all in my head, or it's autoimmune things come in flares, and then it gets better for a while. So it would get better, and I would think, oh, it's better now, but I had a lot of pain that just got worse and worse over time and limited my function, and I ended up having to leave jobs and things like that because I just couldn't physically do it, like playing music and farming and I don't know, even typing to a certain extent.
A lot of the things you enjoy doing, hiking.
Yeah, like everything that I like, I couldn't do anymore. So that was great, but I like got so used to losing these things that it's like I wasn't even thinking thinking of it as something that could be treated at that point, because I was so used to being told by doctors like, oh, you have this like random incidental tendonitis in your elbow that couldn't possibly be connected to your skin psoriasis. Yeah, go meditate. Try this diet. No, people like friends and family are the ones that say, try this diet. Try this diet. It cured me. And then another one I get all the time is like, have you been tested for Lyme? And yes, I have been tested for Lyme like 5 times. Yes, the good test. I don't have Lyme. So anyway, the moral of the story is that when I was pregnant with our child, I was like totally in remission and like fine until I started cutting down on breastfeeding like over the summer. And then my skin psoriasis came back first. Came back in areas of the body I shall not mention in public. And also my head. You might not be able to see it because I'm wearing makeup right now because I'm extremely vain. No, that's not why. Jonathan might disagree. So my skin psoriasis came back, and then I started being just real tired and having pain in the bottom of my feet that I thought was from my shoes, and all kinds of achiness, and I kept waking up and saying to him, like, I think I'm getting sick, and he was like, it's autoimmune, and I was like, maybe I have a cold, and he was like, it's autoimmune, you make an appointment with your doctor, and I was like, doctors won't listen to me, they never listened to me before, and he was like, I'm the man of the house, I'm making an appointment.
That's not at all what I said.
That's not what happened. I was like, well, I'll go if you make the appointment. That's what actually happened. So I went to my doctor, and my doctor was like, oh yeah, we did send you to rheumatology before. Oh yeah, your other doctor didn't think it was psoriatic arthritis. This is like textbook psoriatic arthritis. You have psoriasis and arthritis. So you should go to a rheumatologist.
Yeah.
And then I did, but it took like 6 weeks to get in. And I went, and they were like, oh yeah, that's totally psoriatic arthritis. Also, all these other things that you've had happening.
The hearing loss.
The hearing
GI
problems, GI problems, like all connected, all autoimmune. And there's treatments for it. So, which is like what we're really making this video about, is that, but you kind of needed the background. What happened when I went to the rheumatologist, and then I had to get a lot of blood tests, and then they were
a
like,
lot of tests, and then
yes, you really do have psoriatic arthritis. These blood tests agree.
they had to confirm that you didn't have certain ailment, like viruses or bacterial infections, so that we could begin treatment.
Right, because the treatment that we decided to do was biologic treatment, and there's like kind of like 4 main classes of drugs for psoriatic arthritis, and also the other inflammatory arthritises like rheumatoid arthritis, etc., which are NSAIDs, which stands for non-steroidal anti-inflammatory drugs, and that includes things like ibuprofen, and then also
Naproxen.
Also, like that's his personal favorite, and then also things that are what's the word, prescription, like
anti-malarial.
No, wait, we're not there yet.
All right,
Also things that are prescription, like Celebrex. That's also an NSAID. There's lots of them.
Oh.
And then I didn't include anti-malarials in my list.
Okay.
There's also anti-malarials, which are originally for malaria, but for some reason they also work on people whose whole bodies are inflamed and attacking themselves.
Mm-hmm.
So anyway, the point is I couldn't take NSAIDs because of my GI problems, because they can cause ulcers and stuff. I couldn't take anti-malarials because they're ototoxic, which means they can damage your hearing in some people. Not everyone. They're great for some people. But for me, I already have hearing damage, so I wasn't going to take those. And then DMARDs, which are disease-modifying anti-rheumatic drugs, which includes things like methotrexate, which is really, really commonly used as like a first line after steroids treatment for psoriatic arthritis and rheumatoid arthritis, but it can harm a developing fetus, and since I am of childbearing age and we might want to have another child, and just because there is a chance that I could get pregnant, my rheumatologist wasn't comfortable with that. Like, she doesn't prescribe that at all to people of childbearing age. So all of those are out of the question, so we got to jump the line straight to the newest, fanciest, cyborgist.
Mouse cloning.
I got distracted.
Biologic
drugs.
Yeah.
These are the ones that you see on TV, and if you know about the only famous person with psoriatic arthritis, Phil Mickelson, the golfer, he hawks them in the ads. At least he used to. Humira is one of them. Enbrel is one of them. They're on TV a lot. At least they're on our TV a lot. But that's because our phones listen to us and then talk to Hulu. This is our PSA for the moment, which is funny. That's also the abbreviation for psoriatic arthritis.
Wow.
PSA.
Didn't actually think of that.
Yep. So we got to jump the line straight to biologics, and there's lots and lots of them. And they're usually given by either injection or infusion. And injection is they get shipped to your house and you poke yourself once a week or once every 2 weeks.
Or have somebody poke you.
Or have someone poke you, but he wouldn't do that for me.
I don't like needles.
No, he doesn't like needles. So the other is infusion, which is not it's not infusing no, that's diffusing. It's not
an
tea.
IV.
It's an IV.
Yeah.
I was trying to be funny. It didn't work. Yeah, that's an IV. So that's very medical, and I have an IV fear. But my rheumatologist and her husband, the infusion nurse, were like, you guys live in an apartment complex. We don't really want people stealing medical supplies from your door. And Casey, you are an extremely anxious person, and you're going to freak out if you have to do this to yourself and then you like sneeze after and think you're dying from a side effect. So please let us infuse you under supervision.
Yep.
Basically. And yeah, so
we went through two.
There were two main ones that are in the class that they usually start people off with, and they're Remicade and Simponi Aria. And we should probably stop and say, like, we didn't say what biologics are. This is going to be like a terrible description. Really, really bad. So look it up yourself. Look it up yourself. Go to, like, the Johns Hopkins Rheumatology website. They have lots of videos made by doctors. This is a terrible description. But anyway, so biologic medications are called that because they're, at least the one I'm taking is it's a human monoclonal antibody, and it's a protein, and they actually like take cells from humans and do something to it.
Some science.
Do some science to it, and they put it in a mouse, and then they do some more science, and they take it out. This is a really bad description. And then they do some more science. And
they replicate it.
And they spin it around, and then they replicate it. They make it so it'll replicate itself. And then
they collect all the replications.
They get their ladle out, and they scoop it up. And you put it in a beaker, probably. There's probably a beaker.
Somewhere in this process.
You know. And they make it into a medication, but the point is that it's a protein.
It comes in a bag in the final form.
It's actually in like a little vial that they put into the bag.
Oh, okay.
But it's a protein. It's like a protein based on actual human proteins, antibodies. My cousin will see this video and she will cry.
Because we're doing such a bad job.
She's a biochemist and she works in pharmaceutical manufacturing, and she'll be like, I knew you weren't the smart one. Anyway.
I could just like read exactly what it does off of the website.
It's fine. Okay. We'll make another video that actually describes this. We're going to make another video that actually describes this really well. And then we're going to make another video that actually describes what psoriatic arthritis is really well.
This is the fun one.
We're just delirious, and I wanted to vlog this experience before I didn't, and we forgot to do it all day while we were there and before and everything. So here we are.
We'll get to that.
We'll get to that. So, okay, that's what biologics are. And this particular type of biologic medication is called an anti-TNF medication, which means it inhibits tumor necrosis factor, and tumor necrosis factor in your joints when you have psoriatic arthritis causes a lot of inflammation, and it causes the bones to like do wacky stuff that they're not supposed to do. And so the proteins in the biologic medication go in there, and they're like, tumor necrosis factor, you calm down, and then it calms it down. Hopefully. And that's what happens. But it's like this giant protein, so they can't make it into a pill because it wouldn't survive digestion. So that's why it has to be a shot or IV. Anyway, we're finally to the point of the video. What was it like to go get this medication infused into me?
So the first time around, should we talk about that?
Oh yeah, so the first time I was supposed to get Remicade.
And that would require her to take preloading of Tylenol and Benadryl.
Yeah, pre-medication of Tylenol and Benadryl just in case you get a headache, and the Benadryl to prevent allergic reactions to the medication. It's also older and it has a longer track record, and my insurance was like, yes, please use this medication, which is why we were starting with it, because so I could start something right away. It also takes 2.5 hours to infuse, as opposed to Simponi Aria that takes half an hour.
Which is not a good idea for somebody who has a deep-seated IV fear.
Right, and a deep-seated not sitting still ability.
Yes, and also somebody who's not entirely high up on taking things like Benadryl and Tylenol in pill form.
Right, because of my GI problems, I haven't been able to take oral medication. So,
yes. So that was the non-option.
We decided not to do that. Actually went to my appointment to get the infusion and ended up hitting the eject button at the last minute. And we decided to get pre-approval from my insurance for Simponi Aria, which is the generic name is golimumab. It rolls right off the tongue. Golimumab.
Sounds like from Futurama.
Yes, it's definitely spacey. Yeah, so then we did that today.
Yes.
A week later. It only took a couple days to get the insurance approval.
And
I know it's a lot longer process for a lot of people, but apparently New York State Medicaid is really good.
Yeah, who would have guessed? Socialized medicine. Yeah. So we went in and to put into context, we were very, very well prepped. We had pillows, we had stuffed animals, we had books, we had Kindles, we had, what else do we have?
Tea, coffee,
yes.
Water.
We had a list of things we probably wanted to watch on the Netflix there.
Oh yeah.
We were ready because
we were really ready because originally I thought I was getting a 2.5-hour infusion, and so I packed like I was gonna take the train.
Yep.
Like I was going to New York for the day, taking the train because it's like the same amount of time.
Yeah. And it turns out that
this was the world's quickest infusion.
It took
like 20 minutes. We just talked to the nurses. It was so fast. It was super fast. And it was also super easy. So if this is something that like your medical provider has brought up with you as an option, or you've like tried other things and this is what's next, and it seems super daunting and super medical and like, oh my gosh, I must be like extra sick if I'm getting this thing through an IV, like what? It was not bad, and I think everything's bad. Like, so this is my prize. If you can see it, it's got dog paws on it because my rheumatologist office has a dog that hangs out with you. It's really nice. So, anyway,
Bixby.
Let's go in order.
Okay.
We got there. We signed in at the desk. The nurse came out and she was like, "Come this way," and then she weighed me. And if you get a biologic medication by infusion, they always are going to weigh you because the amount that they give you is based on your weight, which is one of the benefits of it, and they can customize how much they give you as opposed to the auto injectors are like a pre-filled amount. So they weigh you, and then she brought us into the room, and I sat down, and I was like, I kind of have been sneezing and I have my period. Are those problems? And she was like, as long as you don't have a fever, it's not a problem, because you can't have an active infection when you get a biologic medication. Then I like put down my stuff, went to the bathroom, came back. The other infusion nurse was like, would you like some tea or like a drink or a protein bar or something? And he like went and got me some tea, and Jonathan went to the car and got me a back pillow because the chair was too lush for me. I need some lumbar support.
Yes.
And
she's all lumbar support.
Yeah, at least our family car is evidence of that. But yeah, they like already had everything set up. They had like the bag hanging and the tube coming down.
Yep.
And they had the
actual.
I don't know the
needle,
terminology. We should have looked up the terminology before. We'll
everything was ready.
Everything was ready. The little like needle catheter thingy was all out and ready, and
the nurse was very, very helpful in walking us through the process step by step by step.
Yeah, and I should mention, I know some people go to the hospital for this. Mine is just at my rheumatologist's office. It's a separate room, and they have 4 like super lush, like comfy chairs with like little tray tables on the side and a TV and blankets and pillows and a nice dog.
Yeah.
And so they we're gonna put it right there.
Nope.
And I just really didn't want it there because whenever I've had IVs before, that's really annoyed me, and so I didn't even really have to ask. They could just tell that I didn't want it there.
I kind of had words with them beforehand while you were in the bathroom.
Well, I didn't know that. But luckily I have super prominent veins, and you can't see it because the bandage is there, but I have like a really prominent vein right there, and so they put the tourniquet right there, and he was about to put the needle in, and I like burst into tears, because I have IV fear that like somebody's gonna tamper with it and like, drug me, or they're gonna like give me an air embolism. That's my biggest fear. And the nurses were like, that's not even a thing. It would have to be like this much air in the tube. I set it up myself. You cannot do it by accident. It's just not even a thing. Which made me feel so much better, and then I was ready to do it because that was my biggest fear.
They walk you through it.
They're like super understanding. Like, what is this? Like, that's so great. And personally, I blame that on the fact that it is a practice run by a nurse practitioner, and I love like all medical providers who are from a nursing background. But maybe people are just nice and understanding. I don't know. They like want you to get better.
Yeah.
And they want to help you.
They want to help you. And
it's almost like they went into that profession to help people.
Yeah. So.
Yeah. So I was ready once I knew that I wasn't going to get an air embolism. The tourniquet was on. He put the little catheter, the needle in, and Jonathan's gonna have like medical info flashbacks right now. And then they like had slip it out. The catheter's in there. They put tape over it, and they took the tube. And I just want to let you know that his leg is vibrating, and he's probably feeling queasy. This part will be over soon. He was a champ. This guy was a champ.
I'm not the one getting confused.
They like thread the tube around this way just so that you can't accidentally pull it out of yourself, and then tape it back there so there's like a loop so you can't pull it out of yourself. And like that was it. Once it's in, it's already coming down the tube. You cannot feel it going into you at all. They took my blood pressure also. They have to take your blood pressure at least once while you're there. And if your blood pressure starts to drop, they can slow the rate of the infusion.
Yep.
My blood pressure was fine. My pulse rate was fine. The nurses stuck around to talk to us, which was super nice. They had actually scheduled me for a time that I'd be the only one in the room and that they were free to stay. And that's really it. Like,
yeah. 25 minutes later, right?
It was like, it didn't really feel like anything was happening. The only thing that hurt was the needle going in. You could look up and see the bag if you wanted to. If I had needed to go to the bathroom, I could have taken the pole with me and gone to the bathroom. I didn't feel like really lightheaded or anything. I felt a little woozy because I was anxious, but not like any kind of side effect.
Yeah.
And then they were done.
Yep.
And they came and they like just pulled it out, put some pressure on, put some gauze on, wrapped this dog bandage around my wrist.
And then said, "Come back St.
Patrick's Day." They said, "Come back in a month on St. Patrick's Day." And they did say, don't, because these medications suppress your immune system, use really good hand washing, good hygiene when you're in public places and in general, and like don't go around any sick people.
Yeah.
And for me, my question was, I didn't get the flu shot this year because I was so sick and I didn't know if I could. It's fine to get the flu shot with these medications as long as it's the dead flu shot, not the live flu shot. And the live flu shot's like not really a thing anymore unless you get the nasal spray one. So the flu shot's fine, but they did tell me to wait a couple weeks to get it. And that was really all. The only side effect that I've had so far, and to be fair, it's been like 7 hours or 6 hours since I got the infusion, was tiredness. Like I was extremely tired right afterwards, pretty much until now. I'm feeling better now. And I will probably just like pass out as soon as we're done with this. And I just rested all afternoon. And they did say that some people are tired the next day or the day after that too. So Jonathan's going to be around to take care of our kid and me,
and her.
Mostly me. So that's the other thing I would say is if this is a thing that you're going to do, make sure that you either do it like on like a Friday and then you have a weekend, or have somebody to help you out in case you do have some side effects. Increased risk of infection is like the biggest side effect.
Don't go around anybody who's sick. Wash your hands.
Yeah.
Try not to, like, I guess, do some crazy recreational thing that's not entirely.
Don't go kayaking in Baltimore's Inner Harbor.
Wow.
I'm sorry, it's true. I wanted to, and it said if you're immunosuppressed, you're not allowed.
Backstory: I'm from Baltimore originally. So.
That's not on our wall. Queens and Philadelphia are on our wall. I can't motion it. Anyway, yeah. So if I have other side effects, or if I feel like it's working or not working, I will make additional videos, possibly featuring Jonathan, to as an update, because I think this is really valuable. For me to kind of track everything, and also, I know that I always like go to YouTube to look up information on things and people's stories, and I haven't found a lot of psoriatic arthritis stuff. So
we're starting it.
Why not? We have a phone and a selfie stick / tripod and a light and internet access. Let's do this.
Why not?
Why not? That's it. If you have any questions or comments, please leave them in the comments, and I will either answer them, or Jonathan will answer them, or
both of us.
We'll both answer them, or we'll make another video about it. And that's all I have to say. It wasn't too bad. Obviously, I don't know. I could have no hair in the morning. I don't know.
It's a good first step.
But we did it. We're taking steps. We're trying to work on this thing.
And we'll beat it.
I don't think we'll beat it.
All right, we'll manage it.
We'll beat it into submission.
That's a form of beating.
That's a form of beating.
I mean, it's still there, but
yeah,
it's
hobbled. We'll hobble it.
Exactly.
There you go.
Love you.
I love you too. Goodbye, internet people.